Okay, so if you are experiencing knee pain is varied. It can be from a meniscus, it could be from patellar tendonitis. This one is a real general exercise for just strengthening the knee. It's quite mild, so this is a really good starting point. So if you're on the RPE, rate of perceived exertion, if you're injured, these would be some of the first exercises that we may want to start you trying. Rule number one with all rehab, no pain. And when I say pain, like no sharpness, no stabbing, just stop immediately, don't push through any of that. But these are the exercises that are really, really helpful to start with. Now, I love using resistance band tubing. So if you see here in the video, I've got the door mount. So that door mount is just a little foam ball that you can hook to the tubing. I'm using two different resistance bands. I've got medium amounts. I mean, I know that black is a 50 and I think the red is maybe a 10 or a 20, maybe a little stronger, 20 or 30 pounds. So, but I'm trying to just be careful with the resistance. Now here, I'm leaving this in here. Sometimes you struggle. It can take a minute to find the right spot on the door. I couldn't get the foam ball, the strap, to quite lay just how it's supposed to. So it took me just a minute to get it set, but most doors work really well. They've got just enough give that you can put that little strap in, but once it's secure, you're gonna have it be about knee height, maybe a little bit higher so that your leg can dangle. I'm again using resistance band ankle strap. I've got the straps on there. You can check us out if you want to purchase those from us, or you can get them. They're really pretty basic tubing. I'm gonna grab a hold of the knee, see, and we're gonna do 10 pulses. Now you want to keep the pulses relatively small. This is a pretty good range of motion I have here, but just do 10 pulses. And then what you're going to do, you're going to flip your foot to the side and we're going to do side pulses. So you're really trying to contract, hold on to the knee. You're trying to contract more into the knee and the lower leg when you're firing that so that we're getting it from the knee. Then you're going to flip your foot to the other side of the tubing so that it's pushing in and you're going to fire inward, same type of thing, 10 pulses. Then you're gonna stand up, flip the ankle strap around. Usually I like, moving the chair so you can kind of hang on. And we're just gonna do 10. I'm trying to move around so that the video, you can see me, 10 straight forward. So that's basically it. We're gonna repeat that here on this video. Then we're gonna flip. It's really quick. This whole thing should take you just a few minutes, even watching it here. Notice I readjust, make sure it's on there good. And then we're gonna, again, grab the knee behind the knee, 10 pulses backwards, making sure there's no pain. If you do feel pain, sometimes what you can do is bring it back to the edge of discomfort and then do the pulses. There we go, to the outside again. So we're repeating to the outside, but just do, if you feel any pain, pulse up against the edge of discomfort, but don't go to pain. Stop before you get to that point. Now we're gonna again move the toe to the other side. So we're pushing in, firing inwards, kind of like a soccer type kick. And after we get done there, 10 pulses. Stand up, flip the chair around. I think it's easier to use just a chair and just go straight down. Notice I have my hand on my leg. I oftentimes like doing that just again so that you're trying to really tell the body, I want to fire from the knee, not as much hip. You have to be careful with these that you don't start doing all the movements from the hip. So that's why it's pretty important that you want to be hanging on to the knee. There we go, backwards. This is our last round. We do 3 sets of 10 in all directions, all 4 directions. There we go, to the outside. So 10 pulses to the outside again. And notice it should be small movements, should be comfortable. We're going to the inside again, inside. And that range of motion, as I'm looking at it, that range of motion is probably slightly bigger than sometimes you may be able to do. This is the last one where you're gonna flip around, support, and drive that knee forward, 10 pulses. Should be comfortable, 10 pulses, and after 10, that's it. Okay, so you can repeat that. You can do that daily, multiple times per day, as long as you don't break rule number 1, which is no pain. So go out, turn your pain into your power. This is step 1 as you're starting to get out of that knee pain. So good luck. Message me if you have any questions.